In today's video, we're going to discuss some of the most common treatments for dry cough. First, let me explain what a dry cough actually is. Hi, I'm Dr. Marcos, and welcome to the You Stronger channel. Before we dive in, I'd love for you to leave a comment telling me which city you're watching from. A cough is simply a reflex that helps clear your airways of irritants and mucus. There are two main types of coughs, productive and non-productive. A productive cough brings up phlegm or mucus, helping to clear the lungs. On the other hand, a non-productive cough doesn't produce any mucus or phlegm. This type is what we commonly refer to as a dry cough. So, let's take a look at some of the most common causes of dry cough. One of the primary causes is airway hyperresponsiveness. In addition, other conditions such as GERD, gastroesophageal reflux disease, postnasal drip, and viral infections can also trigger dry cough. There are also less common causes, like exposure to environmental irritants, ACE inhibitors, whooping cough, collapsed lung cancer, and even heart failure. Now, let's talk about treatments for dry cough. But before I share this information, don't forget to subscribe to my You Stronger channel and hit the like button on this video. Your subscription and like will help this video reach as many people as possible. Can I count on your support? The first thing you should try for dry cough is honey. Honey has antibacterial and healing properties, and it can help coat the throat, reducing irritation, pain, and inflammation. This makes it great for both day and nighttime coughs. You can take honey by the spoonful a few times a day, or add it to tea or warm water to drink. But here's something important to remember. Never give honey to a child under 1 year old. Honey can cause a rare condition called infant botulism or floppy baby syndrome. This happens because of a bacterial toxin that may be present in honey. Honey is completely safe for older children and adults. Another remedy to consider is a warm saltwater gargle. Gargling with warm salt water is one of the easiest and most effective home treatments. The salt helps draw mucus out from swollen and irritated tissues. Saltwater gargling can relieve discomfort and soothe a scratchy throat. To do this, add about a quarter teaspoon of salt to lukewarm water and gargle several times a day. You can also try using a cool mist humidifier to increase the moisture in your room. If you don't have one, you can still find relief by taking a hot shower. The steam from the shower loosens mucus and can help moisturize and soothe your sore throat. Alternatively, you can breathe in steam from hot water in any container. Ginger is highly beneficial for treating dry cough. It can help suppress the cough reflex by relaxing the smooth muscles in the airways. Ginger also has antibacterial and anti-inflammatory properties, which help relieve pain and discomfort. Studies have shown that ginger oil, a compound found in fresh ginger, can help reduce airway hyperresponsiveness, which triggers asthma symptoms, including coughing. Ginger is commonly found in many teas as an ingredient. You can also make ginger tea by steeping peeled or chopped ginger root in warm water. Adding honey to the tea may enhance its effectiveness for soothing a dry cough. However, it's important to remember that consuming too much ginger can cause stomach upset, heartburn, or diarrhea. Next, let's talk about thyme. Thyme contains a compound called thymol, which is believed to have antispasmodic effects. It helps relax the smooth muscles in the throat. Thyme is generally safe for occasional use. To make thyme tea, steep 3 to 4 teaspoons of dried thyme in 250 milliliters of boiling water. You can add honey for an extra cough-relieving effect. However, it's important to avoid consuming thyme essential oil, as it can cause a dangerous drop in blood pressure. Marshmallow is another herb used in many cough syrups and lozenges to soothe dry cough. Research has shown that it's effective in reducing throat irritation caused by dry cough. Marshmallow root also has antibacterial properties. Peppermint contains menthol, which numbs the nerve endings in the throat that get irritated by coughing. This can provide pain relief and reduce the urge to cough. Peppermint also helps relieve congestion. You can take peppermint lozenges or enjoy a cup of peppermint tea. If you're dealing with a nighttime cough, drinking peppermint tea right before bed can be very helpful. Antitussive medications work by reducing the cough reflex, which lessens the urge to cough. These medications are especially beneficial for dry cough. Some antidepressants, which contain codeine, are available by prescription only. Other over-the-counter medications usually include active ingredients like dextromethorphan, camphor, or menthol. Dextromethorphan is a cough suppressant that affects the signals in the brain which trigger the cough reflex. However, it's important to note that dextromethorphan will not treat coughs caused by smoking, asthma, or emphysema. Dry cough can be very bothersome, especially when it lasts longer than expected. If you're unsure about the cause of your cough, it's always a good idea to consult your doctor to determine the best treatment plan. In the meantime, a combination of home remedies and over-the-counter medications can help ease the discomfort. I hope this video has been helpful to you. Feel free to share it with a friend or family member to spread the knowledge. Don't forget to subscribe to my channel, as it will help this content reach more people around the world. Thank you so much. Legal disclaimer. This video is for educational purposes only, aimed at instructing the public on various topics related to medicine and general health. The information provided in the videos is not intended to replace medical consultations or serve as recommendations for any treatment plans. If you have any questions, please consult your doctor. Medicine is a constantly evolving field, and the videos are based on the most recent scientific articles available at the time of production. The videos are strictly for educational purposes only and do not disclose addresses or phone numbers of any office, clinic, or service.